Approximately 20 million Americans have age-related macular degeneration, or AMD, and nearly 1.5 million of those are living with vision-threatening AMD. With millions of Americans already living with it and hundreds of thousands of cases diagnosed every year, it would make sense for many people to be familiar with AMD. However, many people are not. That's why we're providing a full condition breakdown of age-related macular degeneration. What is AMD? AMD is a vision-related disease that can blur your central vision and is the main cause of vision loss and blindness for Americans aged 65 and older. AMD comes in both wet and dry forms, with the wet form being more advanced and damaging. While AMD often doesn't progress to the wet form, when it does, it can cause severe and permanent central vision loss. What are the symptoms of AMD? Each individual may experience symptoms of AMD differently. However, the most common symptoms include blurry or fuzzy vision, difficulty recognizing faces, straight lines appear wavy, a dark, empty, or blind spot appears in the center of the vision, loss of central vision. These symptoms may also relate to other eye conditions. If you are experiencing any of these symptoms, we recommend visiting an eye care professional for diagnosis as soon as possible. Who is at risk? There are a couple of risk factors for AMD, with the most obvious being old age. Those who are older than 50 years old are at a higher risk for AMD than those who are younger. You're also at a higher risk for AMD if you smoke, have a family history of AMD, eat a diet high in saturated fat, or have high blood pressure. How do you prevent AMD? The best way to prevent AMD is to not smoke. Smoking may double a person's risk of developing AMD and is also generally unhealthy. Some other tips include eating leafy greens, taking supplements, wearing sunglasses, and maintaining a healthy weight and blood pressure. However, no matter how well you work to prevent AMD, there's always a chance for it to develop. If you're over the age of 50, have any symptoms, or think that you're at risk, we encourage you to see an eye care professional for a checkup. If you learned something new or found something useful, please share it with your friends and family. And if you're interested in more healthcare content like this, please consider subscribing. It's free.